video, we're going to look at asystole. So let's start off. Is this readable? And the answer is yes. Sometimes you may have to question whether or not the EKG is even on. P waves, present or absent? There is no P waves. So therefore, there can't be a P wave for every QRS. There can't be a QRS for every P. There is no PR interval. There's nothing consistent, and you can't see anything that is regular. So therefore, we do not have an atrial rate. Is there a QRS? There is no QRS, so therefore we cannot determine any of these other things. So no P waves. Okay, so no P waves, no QRSs. Make sure that the EKG is on the patient, and if it is just a baseline, then you, my friend, are looking at interpreting an asystole. Okay, that's pretty much it. You need to confirm this in 2 leads. Okay, so confirm this in 2 leads, and always check your patient. Okay, so you always need to check your patient, particularly with anything like this, before you start doing a whole lot. Make sure that they are pulseless and apneic. Anybody who has this rhythm is going to be pulseless and apneic. So if they're talking to you, it's not an asystole. Okay, always check back to the machine to make sure that that's okay. Make sure that they don't have a pulse, and if they don't have a pulse, then you may need to be doing CPR. Talk to you later.